So now we're going to introduce our speakers. Usually in my introduction, I go right to the speaker, but in this introduction, I have a little bit of a preamble. So sometimes folks ask me how I get our speakers. So I read, I listen to the news and podcasts, and I listen to what folks around me are talking about. So I like to share with you the backstory of our speakers today. So back in April, I heard Al Mertzucci on NPR talking about his bill, AB 279, on senior residential. And it's not every day that I hear our 66th Assembly member speaking on the radio. So I thought this bill he was talking about was pretty important. And I mentioned this to Leslie Borden, who is the founder of Handmade Especially for You, who I've been volunteering with for the last 10 years. Handmade Especially for You provides handmade scarves to shelters who house victims of domestic violence. And over the years, Leslie has shared the landmark cases her son, Matt Borden, has been litigating, including the one we'll hear about today on nursing homes dumping their patients. I thought if Al Mertzucci could talk about his bills, it would be wonderful if Leslie's son, Matt, could talk about his nursing home cases. So I asked Leslie and her husband, Phil, if they thought Matt would talk, and they said, of course. It hadn't occurred to Leslie that our meetings are still virtual, and this wouldn't be an excuse for Matt to fly down from the San Francisco area for a visit. Once I lined up Al Mertzucci to speak, I emailed Matt and of course CC'd Leslie to let him know we weren't just some dubious Dems club. Matt did say yes and said he was very familiar with Al Mertzucci's bills and that he works with the California Advocates for Nursing Home Reform, advocates who also helped Al draft his bills. Coincidentally, in the AARP's June bulletin, their featured in the news item was on the nursing home dumping case that Matt helped litigate, and he will talk about today. So now here's Matt. Matt co-founded commercial litigation boutique Braun Hagee and Borden in 2009. The firm has since secured numerous groundbreaking judgments and settlements, including a highly publicized top 100 national trial verdict in 2019. As part of his practice, Matt has led numerous impact cases to change the law for important causes and underrepresented populations. His cases include litigation to prevent police from attacking and dispersing journalists covering Black Lives Matter, protests, lawsuits to prevent the illegal dumping of nursing home residents, actions to protect international human rights advocates and organizations, cases to secure environmental justice, and suits to prevent the misuse of psychotropic drugs in nursing homes. So please welcome Matt Borden to the Palos Verdes Democrats.
Thank you, and thank you for the warm introduction. I'm going to try to do a share screen again. Let's see if I get this correct. Can everybody see? Yeah.
Yeah, yes. It looks good, Matt.
Okay, good. And I'm a lawyer in San Francisco, and I do a lot of impact work in addition to a bunch of commercial litigation as well. And one of the areas that we focused on is protection of elders. And this issue of dumping is a particularly important one. I would say, you know, there's the illicit use of drugs in nursing homes to sedate people, and then there's dumping, and these two things probably constitute the biggest threats to the elderly population that exist. And the idea is when you take somebody into your nursing home, you're not just, it's not like a landlord taking on a tenant. You're taking responsibility for taking care of them. And as a matter of law, once you take them in, you can't just get rid of them or toss them out like trash. And what I'm going to talk about today is the fact that that is being done really very systematically, and there's not really very much that's being done about it except for private litigation. And one of the reasons why it's so bad is that it causes something called transfer trauma, which is when you have someone who has dementia, they rely on the familiarity of their surroundings. And if you put them into an entirely new place without any warning, you tear their family apart, and you also wreak mental havoc on them, and people can become so despondent that they actually pass away. So with that, this is the general overview. I'm going to probably go for about 20 minutes. I can go for longer or shorter depending on what people want to hear, but I'm going to go through the basics. What is dumping? Why is it a problem? And then, what are we doing about it? I'm not very good at math, which kind of explains how I ended up going to law school, but I did prepare a kind of simple equation here, and this tells you pretty much everything you need to know about dumping. And what this shows is there's 3 sources of reimbursement for nursing homes when they take in people. One is Medicaid, and that's from the state, or Medi-Cal. The other is private pay. And then the third one is Medicare. And a Medicare patient is a short-term patient, and they get, in addition to a Medicaid reimbursement, the facility gets $1,000 a day more for the Medicare payment. And so you can see, if you're a facility and you're trying to maximize the amount of money that you get, you want to get rid of the Medicaid people and you want to bring in the Medicare people. And so, $1,000 a day might not sound like that much money, but if you have a facility and the facility has 100 beds, and then you think that they're part of a chain and the chain may have 30 facilities, you multiply that by 365 days a year, and you're talking about over $100 million. And this is all just gravy or unfair profits that nursing homes are reaping when they are actually getting rid of the Medicaid patients to bring in the Medicare ones. This is kind of the mechanism of it. There's kind of, I guess I've classified them. These are not, terms of art or science or anything like that. But the first kind of dumping that, I've seen ubiquitously is hospital dumping. And that's when a facility either sends a resident to a hospital, or the resident just goes to the hospital on her own, and then the facility won't take them back afterwards. So it would be the equivalent of, if you went to the doctor, your landlord basically changing all the locks while you were out. And as I mentioned from the top, you can't do this. The reasons why you can discharge someone once you have taken custodial care and taken up the obligation of providing care for them are very, very limited. And it doesn't have to do with the fact that you don't want them to come back from a routine hospital visit or even a non-routine one. And there's very strict procedures you have to follow when you discharge someone. You have to have a doctor make a determination that the discharge is warranted. You have to look for a new place for the person to stay and make sure they have somewhere to go. And you have to orient the person around leaving so that you don't have this transfer trauma that I mentioned before. The second one, what I call a pressure dump, is when people from the facility will tell the resident or a family member, we can't take care of you. Or, your mom's going to get hurt at this facility because we can't take care of her. And it'll be your fault. These are all illegal pressure tactics that, do not involve having a doctor look at the situation, having a discharge plan and orienting the person to the discharge. They basically force people to leave The last kind, the insurance dump, there's a certain group of residents who have insurance that pays for their nursing home stays. And so sometimes the insurance will just decide that they miraculously got better. So, I had a client who got run over by a car in a crosswalk. She had more than 10 broken bones. She had a ruptured spleen and just a lot of medical issues. And the insurance company said, "You're better and we're not paying anymore." And so the facility then kicked her out because they weren't getting paid. There's another case, another example of that. There's a popular chain in the state called Plum. They had a guy who they wanted to get rid of, and so he was non-ambulatory, so they just put him in a van and they took him to his house. Nobody was there, so they pried open the window and then they just put him through like a piece of mail. And luckily, they were able to find him after a couple of days. But that is sort of an extreme example of the insurance dump. And this is an important thing to discuss is why it's a problem. And why it's a problem, it's not a legislative problem. The law is very good. The law is favorable to residents. The law protects people. The law gives the state the ability to do all kinds of, coercive things to nursing homes to make them stop this practice. But the state has done nothing. And that is the source of, one of the pieces of litigation I'm going to talk about. I'm going to talk about two, as Anne sort of referenced. One is our lawsuit with Canner against the state of California, and the other is a private institution that was written about in the AARP bulletin. But the facilities understand that if nobody is going to enforce the law against them, they don't have to follow it. And if you combine it with that sort of profit maximizing behavior and the incentive to make more money for themselves, it's a big problem. And the state is part of it. So this is the sort of what are we doing about it? And we, I mean, my law firm and Canner, we decided that we were going to bring a lawsuit against California to try to get them to enforce some of the existing laws that are there to protect against dumping. So one of these laws is that you have a right to a hearing if you have been hospitalized and the facility won't take you back. And the hearing is administered by the state. And as a result, the state will issue an order, and that order will say whether the facility has to take you back or not. And one of the problems is that California has not been enforcing its readmission hearing orders. So this gets slightly technical. I don't know if you can read it, but I can show it to you. This is an org chart for the California Health and Human Services. And so sitting at the top is Health and Human Services. And then sitting below are these two organizations. One is the Department of Healthcare Services. And the Department of Healthcare Services provides the hearings to residents. And what they do is they have a hearing officer, they have a reporter, everything is recorded. You have the right to counsel, the right to present evidence. They do a great hearing. They generate a great order that has the reasons why the facility does or doesn't have to let you back in. But then they've taken the position that once they issue their order, their jurisdiction is over. And so they can't enforce it. So the second agency down here is the California Department of Public Health. And the California Department of Public Health is kind of the enforcement wing of Health and Human Services. But what the California Department of Public Health has said, and they've issued a public memo to this effect, is that we don't enforce hearing decisions issued by Department of Healthcare Services because we're not present at the hearings. And so you have a hearing and you have all the sort of hallmarks of due process, but it's basically what the Ninth Circuit has called a meaningless show trial, because win, lose, or draw, you're not getting back into the facility because everybody understands that you don't have to obey this piece of paper that you get because nobody is going to enforce the order by the state of California. So just to put a face on this, these are sort of legal concepts, but this is where the rubber meets the road. This is my client, Bruce Anderson, who's one of the plaintiffs in this case. He suffered a heart attack when he was fairly young, and it cut off the blood flow to his brain for so long that he suffered brain damage. So he has, you know, a young person's body, a relatively young person, but at the same time, he has symptoms that strongly resemble dementia or Alzheimer's. He had pneumonia. He went to the hospital to get better. He got better, and the facility wouldn't let him back in. And so he had to live in the hospital. And living in a hospital is terrible. You have no social activities. He could walk, but he was not allowed to get out of bed. And to help prevent him from getting out of bed, they were shooting him up full of Haldol and other very strong sedating drugs. And they were also putting a cage over his bed so that he was actually caged in there. He lived in that bed for over 365 days. During that time, you know, he was separated from his family. He had none of the things that you get in a nursing home. And to top it all off, everybody on this Zoom meeting was paying an exorbitant amount of money for Bruce to sit in a hospital bed instead of in a nursing home where he belonged. And that's Sarah, his daughter, on the left. This gentleman, also one of my plaintiffs, he's since passed away. His name is John Wilson. He has ALS, which is Lou Gehrig's disease. He's only able to communicate at this point, by the time he was dumped, by moving his eyes. He's paralyzed everywhere else. And so he's very familiar with the caregivers at the nursing home where he lived. And he could communicate with them when they, you know, refused to take him back from the hospital. He was in somewhat of a terrifying situation where he couldn't communicate in the one way that he could sort of communicate because nobody knew how to do it. And he lived in the hospital for over 8 months. It cost over $1 million to keep him there, and they eventually took him back. One thing that I will tell you that Bruce and John and then Robert, who's my third client in this case, all did is each of them went and had a hearing before the Department of Healthcare Services that they won. They were legally vindicated. Their right was absolute to return. It had been, you know, judged in their favor, and the facility simply wouldn't do it. And they wouldn't do it because there was no consequence, and that's why we sued the state. This was our last client in this case. Robert passed away earlier this year. He had a stroke, and he was doing well, sort of recovering in his nursing home. And then they sent him to the hospital on a pretext and wouldn't take him back. And as he was languishing in the hospital bed, he started to lose all the mobility and the gains and the control of his body that you get when you're trying to come back from a stroke. And so his sister, who was really his closest relative, and she used to come visit him every week and clean his clothes and take him to dinner at her house, couldn't find a place in the Sacramento area where he lived, and ended up having to get him into a home all the way in LA. And so she couldn't really see him anymore, just, once or twice a year. And again, he won his hearing against the state. And so anyway, we brought a suit against the state to do it. I thought that it would be a relatively easy case, because even if you are antagonistic to the rights of people like my clients, you could at least see that you're going to save taxpayers tens of millions of dollars. But our suit has fallen on deaf ears, and it's still ongoing. And as I mentioned, 2 of my clients have already passed away. The other case I'm going to tell you about very quickly, this is the one from the AARP bulletin. This is Gloria Singal on the left. That's her husband, Bill Singal, on the right. And they lived together in a nursing home that was owned by an organization called Retirement Housing Foundation. And Retirement Housing Foundation decided that they were going to dump Gloria. So they basically had her sent to a hospital for a psych evaluation that she didn't need. She has dementia. And so the hospital cleared her to return, and they wouldn't. And so her son, Aubrey, had hearing before the Department of Healthcare Services. Aubrey very bravely went up against Retirement Housing Foundation and its cadre of lawyers, and he won. And the Department of Healthcare Services ordered them to readmit Gloria so that she could be with her husband in their sort of waning days. And Retirement Housing Foundation wouldn't do it. And they wouldn't let her back in. They wouldn't follow the state's order. Our lawsuit against the state was already pending to try to make the state enforce these things. And so we decided that we would sue the facility directly, and sue the organization, Retirement Housing Foundation, directly. This lawsuit is also ongoing. I'm sad to tell you that Gloria and Bill never saw each other again after they dumped her in a hospital. Bill passed away a few months later, and Gloria herself has passed away as well. And so that suit's ongoing, and we're trying to get an injunction to prevent Retirement Housing Foundation from doing that to other people, and they're fighting like crazy. This is a picture of the executives of Retirement Housing Foundation. We've kind of explained in the complaint that they are, not paying tax. They're a supposed religious nonprofit, but they have, and they're run by that gentleman, Laverne Joseph, who has the evil red arrow hovering over him. But they're engaged in for-profit behaviors, and the for-profit behaviors are dumping people and understaffing their facilities. And so I have better news to report in this case, in that we've got a partial judgment against them, and that was in the AARP bulletin. And so now the main thing that we're doing is we're trying to make sure that all of the responsible parties are actually enjoined from doing this. And this is going to, perhaps bleed into some of the things that Assemblymember Muratsuchi is going to say about the legislation that he's passing. But these nursing facilities are incredibly Byzantine. The structures that they've created are impossible to figure out. And I just made, this is a drawing. This is the structure, corporate structure of 6 facilities that I made in a different case. And this is why his bill is so important, is that you can't tell who's responsible. You can't tell where the money that's supposed to be going to take care of people actually leaks out into the pockets of people like Laverne Joseph or the owners of these facilities. And it's supposed to be sort of transparent and regulated, but you can't really do it if you got 6 facilities that are turned into 20 some odd entities that you see on the screen. So, so that's kind of my general overview. I'm happy to answer questions or talk about additional things. I know that our time is somewhat limited, but I really appreciate the opportunity to tell everybody about these cases.
Thank you, Matt. Actually, you can continue, but what we'll do is have first, let me introduce Assembly Member Almer Tsuchi, and then we'll have questions afterwards. Okay?
Okay.
So Assembly Member Almer Tsuchi is our District 66 representative and fighter for the South Bay. He's been championing many bills in 2021 focused on us recovering from the COVID pandemic, environmental justice, closing the digital divide, and of our topic today, protecting our most vulnerable residents in intermediate care and nursing facilities, which is AB 279, and reforming the nursing home industry, which is AB 1502. So without further ado, please welcome Assemblymember Almer Tsuchi to Palos Verdes Democrats.
Thank you, Ann, and good afternoon, Palos Verdes Democrats. This is a great program as always. I know the PV Democrats always brings on great speakers. I was listening to Mr. Borden talking about his important work in enforcing many of the laws that we have in the state of California, where he's highlighting that one of the biggest challenges in regulating the nursing home industry here in our state is, not just passing bills and creating laws, but making sure that the existing laws are enforced. And, we have this huge problem in the state of California that's only been highlighted during this pandemic, this issue of especially unscrupulous nursing home operators, nursing home owners that have not been providing quality care to some of our most vulnerable Californians, our most vulnerable residents, the nursing home residents, nursing homes, as well as a smaller category of these senior residential healthcare facilities, intermediate care facilities, which I'd like to talk about in 2 of the bills that I'm working on. So just a quick overview. I think all of us remember that in the early stages of the pandemic, up to half of all of the deaths that we were seeing from COVID-19 were occurring in nursing homes. And that just highlights again, the vulnerability of our nursing home residents. While with the vaccine rollout, the numbers of nursing home deaths among residents has declined. It's still at least 16% of all of the COVID deaths that have been documented. And of course, there are many that are concerned that even those numbers that we've had reported may involve an undercount of nursing home deaths in here in our state. My involvement on this issue started with one particular intermediate care facility, not in the South Bay, but in Boyle Heights. But it came to my attention because, I've been active in the Japanese American community for many years, and there is this wonderful nonprofit in the Japanese American community that used to operate 4 skilled nursing facilities as well as 1 intermediate care facility throughout Southern California, 1 in the South Bay, 1 in Gardena. But this facility that's located in Boyle Heights, they basically announced that they were going to shut down their facility during the pandemic, in the middle of the pandemic, in order to convert their facility into luxury apartments. And so there's been a huge uproar in the Japanese American community. It's gotten a lot of support from the broader community. But it just got me to start thinking. This was back last summer when we were hearing about all the deaths involving nursing home residents from COVID, and Mr. Borden talked about transfer trauma. I mean, I know that many people in the community were talking about not just their vulnerability to the coronavirus, but also, this talk about shutting down this facility and transferring them during this most traumatic period. You don't have to be a nursing home resident to understand the transfer trauma of being transferred during at the height of the pandemic to some other unfamiliar facility. And I think, as Mr. Borden highlighted, this is particularly so, for many of the nursing home residents who may suffer Alzheimer's or other conditions, that it can be indeed fatal to expose them to this kind of transfer trauma. And so I reached out to the same organization that Mr. Borden's been working with, the California Advocates for Nursing Home Reform, or CANNER for short. And I asked them for their help in working on this bill idea that I had, which was to prohibit all nursing home evictions as well as involuntary transfers unless medically necessary during this COVID-19 state of emergency. And so that became AB 279. This bill has been making its way. It was passed by the California Assembly, and we're awaiting our first hearing in the California Senate Health Committee. But we just received word that it's received opposition from the California Department of Public Health. Raising some issues. I see Mr. Borden shaking his head there, but it's this it just highlights the ongoing challenges of trying to regulate this industry when the regulators, the enforcement of the existing laws and regulations has been so lax, non-existent, ineffective. And so that has led me to work with CANNER on a second bill, which is Assembly Bill 1502, which is seeking to strengthen the Department of Public Health's authority to disqualify unfit owners and operators before they're able to acquire and operate skilled nursing facilities. One of the poster entities of nursing home, unscrupulous nursing home operators in the state of California is in fact the largest for-profit nursing home chain in the state. It's Brius Health, and there's been numerous articles about this operation, but one of the things that they use is that they acquire a nursing home, that's going through a bankruptcy proceeding, but even without a renewed or effective license, they're able to continue to operate these nursing homes using what are called these interim management agreements, and so they're. Even though the state of California by law requires a nursing home operator to be properly licensed, there's this, this practice that we're calling squatting, where basically these new owner operators, they use these interim management agreements to avoid, and with the delay from the State Department of Public Health to renew these. To properly review and to issue new licenses, they're able to continue to operate without renewed licenses for up to 5 years or more. So that is the second bill that I'm working on with Canner, I would agree. I agreed with most of everything that Mr. Borden said, except for one thing, which is that he was rightfully focusing on the problems with the enforcement of the existing laws. But I think there are gaps and loopholes, and also in the existing laws that need to be closed, and that is the primary goal of AB 1502 that I'm working on with Canner. But clearly we have, we're dealing with this. Let me just wrap up before answering any questions. But we're dealing with this industry where they've been able to figure out this business model where they can be extremely profitable by relying upon taxpayer dollars. As Mr. Borden indicated, most of the nursing home, on average, about 85% of nursing home revenues comes from either Medicare or Medi-Cal, or the California's version of Medicaid, and so they're getting all these taxpayer dollars, but they figured out these business operations using a lot of the opaque corporate structures that Mr. Borden presented in his in one of his slides. But they're able to use these opaque corporate structures, as well as this practice of using related parties. Where you operate a nursing home, and then you contract with a medical supplier that's owned by the owner of the nursing home, and so when they look to not only the medical supplies, they're just churning the money within their own ownership network. The same goes in terms of financial services, in terms of other professional services that it takes to operate these nursing homes. And so bottom line, we need to reform our laws so that our regulators, the State Department of Public Health, can more effectively regulate, especially these bad operators. It seems like the number of abuses, the number of penalties that have been imposed against these nursing home operators, they seem to be more pronounced with the for-profit operators than the private nursing home operators. But still yet, I think it's a systemic problem that we're trying to address to ensure greater enforcement and accountability in the California nursing home industry. So with that, be happy to answer any questions along with Mr. Borden.
Okay, let's maybe Reggie, we can show both Matt and Al together. So I'm going to let them continue some of their discussion, because one of the things that has come up, it came up in a question, and there's other legislation even by Senator Allen, but it's not just like Al was saying, it's not just the nursing home, it's intermediate care. It's Karen Klink raised the question about it's also assisted living, memory care. There's other groups. And actually, Senator Allen, I thought he was going to have a rep today, but anyway, he has a bill, SB 664, which has to do with hospice and how unregulated they are. So it's a very intertwined problem. So maybe the two of you can both respond to that.
Sure. Well, I hadn't meant to suggest that legislation is not necessary. The thing I would say in the realm of this narrow area of dumping is that the enforcement tools are there for the Department of Public Health if they want to be the ones to do it. The thing is, if you make $1,000 a day from dumping someone, you have to pick a penalty that costs more than $1,000 a day. Otherwise, they're going to still doing it, they're going to still do it. And so that's been part of the problem, is they just don't impose any penalty at all. But even when they do, it's just such a slap on the wrist. It doesn't stop anybody.
Yeah, and I just want to follow up that I've had to rely on Canner of folks that have been working to reform the nursing home industry and to enforce the existing laws. Because I didn't come from a background of working with nursing homes, but since my starting to look more closely at some of these issues, I've been really struck by the number of articles, written in the New York Times, the Washington Post, the Los Angeles Times, the Sacramento Bee, that have been calling for reform, and yet, it's been difficult. I like Matthew indicated, and a lot of times the fines are a slap on the wrist. There are these unreasonable delays in terms of the approval or the denial of these licenses, which unfortunately has made a lot of these efforts to regulate the nursing homes either non-existent or unfortunately a joke. There was a New York Times article that was talking about during the pandemic that nursing homes, not just in California, but across the country, were, dumping residents at homeless shelters, and in the meantime, chains like the Brias Healthcare, they've received not just over $800 million from Medicare and Medicaid, but also on top of that, they've received some of the CARES Act funding, to presumably give them the help that they need to get through the pandemic with the additional costs of personal protective equipment and others. But still, yet we see these abuses, not only continuing but perhaps getting worse during the pandemic because of the difficulty and many of the regulators to get access into what is actually happening in these nursing homes. So yeah, this has been a big challenge.
Okay, Karen, you have your hand raised. You want to unmute yourself, Karen? Or not?
Hi, Karen Klink here.
Okay.
Thank you, Mr. Borden and Al, for finally, making this, for everybody to notice. Mr. Borden, yeah, all of those things that you mentioned have been going on. And of course, during the pandemic, it was, way worse. And, part of the problem is that there's different regulators between, the assisted living and the other kinds of intermediate care than there is with nursing homes. Nursing homes are, more federally, the federal government, and and then the other is a state regulated thing, so they kind of have to be looked at through different lenses and different regulators. And my mom is in memory care, and we haven't been she hasn't been dumped, but she certainly has. But we have been pressured on many occasions, to say, we don't like you, so we think you should move your mom out, and it's very stressful. All the things that you guys are doing are fantastic, and Canner is great to work with. We work a lot with them. So the issues, are one of the problems is these agencies are so behind, they can't get into to do all the, to get in there to see what's going on. They're so behind, they'll never catch up. So thank you for for helping me to understand more. I'm part of a group called Essential Caregivers, and we're working on getting, better visitation even still. So I just want you guys to, keep up the good work and help, that Brias, I think, is that Shlomo Rekovic, I think his name is. And, that he's notorious for. So the problem is, I'm asking you that the care homes are still, nursing homes are not a great place anyway, and they absolutely need more regulation. So I appreciate you guys doing the work, and thank you very much.
Thank you.
Thank you. Did you want to comment on what Karen said, or I'll go on to the next?
I think there's a lot of stuff to comment on in there. I will say that the talk that I gave was focused on nursing homes. Assisted living is an entirely different kettle of fish, as Karen pointed out. Assisted living, you're not getting, federal money. These are all just sort of private contracts. It's much less regulated. It ought to be regulated a lot more. And there's a lot of people living in assisted living facilities, and really the idea of an assisted living facility is supposed to be, it's assisted living, it's not nursing care, but something like a memory care unit, starts to look a lot like, skilled nursing, and what you need in that area is people that are trained in dealing with dementia. And some memory care places have that, but it's a lot closer to skilled nursing care, and it ought to be regulated more like skilled nursing care. Is kind of how I see it.
Yeah.
If I can follow, I have a question for Matthew, which is I know that a lot of your litigation is directed against the state of California for its either for its lack of enforcement or to compel enforcement. But is it your sense that, like is often the case, that it is the basic issue the lack of resources, in terms of the regulators, or is it more systemic, ineffective enforcement? What has been your experience?
Well, so there's definitely, in terms of nursing home inspections, they are, the DPH, Department of Public Health, is supposed to inspect nursing homes. And it's hard given the resources that they have. So that might be an area where they're under-resourced. Something like dumping, where it's a very clear legal violation. It's very easy to enforce, but it's one of those sort of classic public policy questions where you have one group that is going to get a major benefit, a major amount of money by non-enforcement, and then you have sort of a more diffuse harm spread out across, the taxpayers paying a little extra money in a way that they don't really feel it. And then the family members of this underserved population, who, and this is one of the reasons why we've taken it on. So I would say that's a result of, a certain amount of agency capture, or, unwillingness to regulate and unwillingness to really do their job. So there's sort of a combination of both. And I will tell you, we have one suit against the state of California. That was the case I just described. The other suits we have been more against nursing home facilities themselves, and trying to litigate these issues against chains to put the chains under injunctions. We've done it a few times where at least, the retirement housing foundations of the world, once we get through with them, won't be able to do it anymore without violating a court order. So, but that kind of privatization of enforcement is not the way it's supposed to work. And, our firm is a firm of limited resources, and we can't be the police for everybody.
Mm-hmm, mm-hmm. Yeah. Well, thank you. I'm always looking for feedback from folks that are working on the front line with a lot of the litigation, want to hear your experiences. But I know that, from the state's perspective, as a state legislator trying to ensure that we have more effective oversight and enforcement over this industry. My first bill, the one that's trying to prohibit evictions and involuntary transfers during the COVID state of emergency period. I just had a discussion with the chair of the Senate Health Committee, who was raising the issue. Well, so are we trying to compel these nursing homes to continue to operate even when they want to shut down? That's one of the challenges that we face. Is how do we regulate them to ensure public protection while at the same time, not driving them out of business or there are limits as to what the state can do in terms of compelling people to continue to operate, especially where we're talking about, sensitive healthcare. I mean, is it in the patient and the resident's best interest to compel these nursing home operators to continue to operate? I mean, these are some of the difficult policy questions that we're dealing with here.
So just as a follow-up to that, Al, Matt showed a picture of an org chart, which was, even though it was too small to read, it was unreadable anyway. Right. So, so we have a question here in chat from Al Shadbourne, but it's basically the same thing. It's how can you regulate, or how, you have the existing laws that are not being enforced, or through that kind of an org chart, how can they be enforced? So what can we do to help you, or to help facilitate the enforcement of existing laws and these new laws that have to be legislated?
Yeah, so I should have done some research. Actually, Aaron, I don't know if you can try to find. There was another bill that was also sponsored by Cantor that sought to require greater transparency in terms of the corporate ownership structures. I forget if it was Senator Henry Stern's bill or someone else, but I believe that bill may have been held in committee, like my AB 1502, by the way, has been held in committee, and that just highlights, something that should be no surprise to Palos Verdes Democrats. I mean, there are some very powerful special interests in Sacramento that block these efforts to even provide greater transparency in these industries. My bills, for example, I mean, there are two big groups that I'm having to deal with. One is the California Association of Health Facilities, CAF. They're basically the lobbyists, the powerful lobbyists for the nursing home industry, and there's also the California Hospital Association. There are skilled nursing facilities that are affiliated with hospitals, and they came out in opposition to my bills, and again, it's like a lot of people they want to, at least the well-intentioned legislators, they want to strengthen oversight and regulation in order to protect patients, but there's always this balancing act, where when the hospitals or even these nursing homes are saying that, oh, you're going to drive us out of business if you pass these regulations. We're always trying to figure out, what is true, what is a lot of smoke, what are these fake cries of oh, the state is driving us out of business, versus what are some of the real concerns about whether we're allowing them to continue to provide services. Again, so in terms of what PV Democrats can do, I mean, of course, it's like everything. It's fighting, contacting legislators, to make sure that we're we can fight back against some of these powerful corporate interests that are well represented through their lobbyists in Sacramento.
Yeah, I'll just add on top of that, one of the great ironies is that this opaque structure that they have and these sort of related party transactions that you were talking about are what enables them to appear on paper to be insolvent or on the verge of insolvency, because they're basically paying themselves a lot of rent or a lot of management fees or other, transaction costs that are just self-payments, and that's how they're smuggling all those profits out and nobody can see. Yeah. And then they turn around and say we're broke.
Yeah. And so that does seems to go back to my earlier question, which is that, because these unscrupulous operators seem to be running circles around our regulators, that it seems like our regulators lack the resources to be able to catch up to a lot of these corporate shell games that these more sophisticated operators are operating with. Of course, I will continue to push for greater transparency bills that provide for greater transparency, but I think there is also, especially as your presentation focused on the problem of enforcement. What's the point of passing these laws if we can't, if they're not being properly enforced? And that's always a constant theme that we're dealing with.
I did see Connie's hand up and then it went down, so I'm not sure if so I'm gonna, while I'm waiting to see her hand up again. You up?
They touched on it in the course of their conversation, so I pulled your hand back down. But I want to say thank you to both of you. This is really important work. The kinds of things that you highlighted make my blood boil. I'm sure everybody else feels the same way. And as Democrats, we have such faith in government to do the regulation. I think this is troubling to us as well. Those are just comments, not questions.
Yeah.
Thank you, Connie. And Denzi, you had a comment about what we just went through with the dialysis clinics. That was on the ballot.
Yeah, it's been a couple times. I'm sure all of you are familiar with it. And just as Mr. Borden was saying, it's a slap on the wrist that a couple of the big dialysis clinics that are, instead of directing their patients toward the only thing that's really going to save their lives, which is get on the list for kidney transplant, try to get that real solution, they want to keep them captured in their dialysis system. And unfortunately, they abuse it by not using the full bottles of medication, dumping it, because Medicare will pay 100% to keep these folks alive. Absolutely. But it's just what you were saying. What made me make that comment was the slap on the wrist comment, that they pay millions of dollars of fines every year. They don't care because they make millions more continuing their bad practices.
Unfortunately, it's a common theme. It's not like drug companies, for drugs like Risperdal, they paid billions and billions of dollars in fines, and they made 20, 30, 40 billion dollars in sales. So just the cost of doing business.
But again, it's what Connie said. Those of us that believe in government so hope that we can just keep the pressure on and regulate and keep us all safe and not be victims of these abuses. And so thank you, Connie, for those comments. Absolutely.
So there's another comment here from Glenn Barish Carroll. So, and I had the exact same thing. So Al, when you talk about us, contacting our legislators, what's keeping your legislation in committee and who should we contact? Maybe that's something you could put in the chat or Aaron could put in the chat.
Sure. I can, please always feel free to contact Aaron or others in our office, as to particular bills, how you can help. In terms of AB 1502 to strengthen the Department of Public Health's authority to crack down on these abusive practices like interim management agreements. It's currently being held in the Assembly Health Committee chaired by Assembly Member Jim Wood, and so he is committed to work with me, in the fall to advance this bill. Similarly, my other bill, AB 279, to prohibit the evictions or involuntary transfers during the COVID state of emergency, it's pending a hearing in the Senate Health Committee that's chaired by Senator Richard Pan from Sacramento, as well as any other legislators. I suspect that most of the people on this call, you're represented by either myself or Senator Allen, and so we're already on your side.
I don't want to bug you.
Yeah, I did get word from my staff that I thought that the bill that was to ensure corporate transparency, which is Senate Bill 650 by Senator Stern. It looks like it did get passed out of the Senate, so I must be confused with another bill. So that is pending in the Assembly Health Committee. To help address that slide that Matt highlighted of the opaque, the lack of transparency in the corporate ownership of many of these nursing homes, please support SB 650. As part of the solution.
Okay. So someone else, James Petrolini, for you guys who we're having a dialogue here, so I can read it, but if you want to say it, but this has to do with doctors who are at hospitals, and they're also medical directors at nursing home facilities. And do they often refer their patients to the nursing home facility that they're the director of?
I don't know the answer to that. That sounds slightly problematic. I don't really know.
Yeah, I don't know either. But that I think if the problem, it sounds like the problem is a conflict of interest, and that certainly should be one of the things that should be prohibited by law. So I have to look into that and get back to you.
Okay. All right. And if James, if you have an example of that, you should let us know. Okay, Barbara, you have a horrible saga here in terms of with the Long Beach Hospital. Do you want to say it, or you want us just to read this about your brother? You can unmute yourself.
Oh, thank you, Ann. Yes, it was really awful, and I put it in chat, and it's all there if you want to take a look at it. Around Christmas, my brother collapsed, went to the hospital, was treated. Because of COVID, all the skilled nursing homes were filled around Long Beach, and the closest one that they could, Kaiser handled all of this because they're his provider. And the closest one they could find that would take him was in Pomona. And I looked up the ratings, the reviews, they weren't good. I had my reservations, but there were no choices. That was it. And so it was a very bad experience. The food was bad. The only good thing, they had a couple social workers that were very nice and somewhat responsive, but administration did not answer my calls and did not answer my emails. His care was minimal. He had physical therapy once in a while, and that was the only time they got him out of bed. And everybody knows the more you stay in bed, the weaker you're going to be. My brother's in his mid-80s, but there's no reason he couldn't regain strength with the right care. So he ended up coming home. They finally released him right before his Medicare coverage was ending. And he came home very sick, and he checked himself right back into the hospital, and he tested positive for COVID, in spite of all the professed precautions that they were taking at this place. And anyway, long story short, there was a pretty good ending. There's a wonderful place in Long Beach. Remember the name of it? It's on, I believe it's on Broadway. It's I can find out. And they did a good job. And they gave him really rigorous physical therapy, and the food was better. The people were much more responsive. And he came out of there a couple months later in a lot better shape. And so presently he is able to manage on his own without a caretaker, because they brought him pretty much up to speed. There is a difference between skilled nursing facilities, I suppose. This was my first experience, and it unveiled a really, really ugly side of this business that they run. So I'm so happy that Al is speaking to this today. I just got in. I couldn't get my Zoom to install on my computer, so I came in late, so I'm hoping I can see a recording of the first part of the discussion. But thank you, Al. Greatest gratitude to you. This is a really important thing that people don't realize until they have someone that they're concerned about that is affected by the situation. So thanks a million, and thanks to Ann and everybody at the Democratic Club for all you do.
Thank you, Barbara. Okay, I don't see any more questions on chat, so I was thinking maybe you guys want to summarize, do a closing, if you'd like.
Go ahead, Matt.
Yeah, I don't know what to say about it in closing, other than that I think that this was a good discussion today, where we really talked about a lot of the important issues, the things that are out there. The thing that that Barbara just sent is I'm really glad that it turned out well for her brother. But it is kind of characteristic of some of the things that we've been talking about, where you have bad care, you have a greedy facility, and then you have them kicking him out right when his Medicare ended, right? And that is the money shot. Your Medicare is over, and they don't want you anymore, and they get rid of you, even if you're sick, and you have to get put right back in. And I've seen that fact pattern happen over and over and over again, and so that's one of the things that we're trying to fix.
I guess I'd like to follow Matt and maybe address a different comment. I saw Dempsey highlight, the ongoing frustration with hearing so many of these awful stories with our healthcare system, and of course, I know that many of us Democrats have been spending a lot of time recently continue to debate single-payer healthcare. I do know that some folks at Cantor and other that I've heard from, they have indicated to me that if you're thinking about checking out nursing homes, try to look for the nonprofits. They seem to have a better track record than the for-profits, which again, it seems to suggest that maybe fundamentally, the problem is with these for-profit healthcare providers. But of course, we know that is the ideal world. In the meantime, we have to deal with the reality of how do we ensure that that there is the healthcare that we need when we need it, and given the complex system that we have now, I think as your representative, I'm going to keep focusing on trying to improve the regulation of the existing nursing home industry to try to ensure greater patient safety, greater public protection, greater transparency of the use of taxpayer dollars, while at the same time try to keep an eye on the bigger picture of the bigger reforms that we need to make in order to make healthcare work better for all of us. So I know that's a easy answer to an extremely complex issue, but I just want to know that I'm thinking about it.
Well, thank you for me. I really appreciate it. So.
Well, it's terrific having you both on. And I mean, just the dialogue between the two of you, we've learned a lot. And just as you said, Al, it's such a complex thing. It's our whole healthcare system. And nobody wants to get sick. And definitely when you don't want to get old and get in a nursing home situation. This Handmade Especially for You group, we just had a gathering, and one of our members came up, and she just got out of a facility which she shouldn't have been in, but luckily her son from up north came flying down to get her out because she had all her mental capacity, and they wanted to keep her in this like nursing home facility, and they were saying, if it wasn't for her son advocating for her, they would have kept her. So it's just the cases you went through, Matt, were just horrible, in that you have to deal with clients who are passing away and still persevering their cases, and it just shouldn't have to be that way. And I hate to say it, but Al, holding your head, you've been holding your head a lot during this meeting, and I think we're all holding our heads right now, trying to get through this. So we need to have more discussions on this, and I'm just very glad both of you could take your afternoon and share what you're doing with us. Thank you.
Oh, yeah, thank you for letting me speak.
Yeah.
I will say, sorry that it ended on such a bad note, but I don't think it's going to get better when they get to the Supreme Court review. So.
Yeah. Well, yeah, but that we have our work cut out for us, and we'll keep fighting. So thank you.
Yeah, I don't think the Supreme Court review is going to make us any happier.
Yeah.
It's all in education. It's all education.